In this lesson, you will learn how to safely assist a resident with using a bedpan according to Prometric testing standards. During the state skills examination, the resident is portrayed by an actor. For testing purposes, you must pretend the resident is not wearing undergarments. Exam tip: evaluators watch closely to ensure you identify the resident and introduce yourself before any physical contact. Before beginning any resident care, perform hand hygiene according to facility policy. Knock before entering. Hello, Mrs. Johnson. My name is Sarah. I'm your nurse aide, and I'll be helping you use the bedpan today. Gather all needed supplies before beginning, including the bedpan, a disposable protective pad, toilet paper, and gloves. Maintain resident privacy throughout the procedure. Ask, do you have a preference for how you would like me to help you today? Place a protective pad on top of the bottom sheet underneath the resident's buttocks and upper thighs. This helps protect the bed linens. There are two acceptable testing methods. Method 1. Assist the resident to roll onto one side to place the pan. Method 2. Ask the resident to bend the knees and lift the hips if they are able. Either method is acceptable. Exam tip: the bedpan must be perfectly centered to avoid spills, which is a major scoring checkpoint. Position the bedpan according to its shape. The wider end supports the buttocks. The narrow end points toward the resident's feet. Ensure it is positioned to collect comfortably. Once the resident is positioned, raise the head of the bed to promote comfort and facilitate elimination. Here is your call light. Please press it when you are finished or if you need assistance. Here is your toilet paper. Take your time. I'll step outside to provide you with privacy. Close the privacy curtain and leave the room to allow the resident a comfortable environment. Mrs. Johnson, I received your call. Are you finished? Pause for their response before proceeding. Before removing the bedpan, put on clean gloves. Lower the head of the bed first. Carefully remove the bedpan and dispose of the soiled linens into the hamper as appropriate. Empty the contents of the bedpan into the toilet. Rinse the bedpan thoroughly. Pour the rinse water into the toilet, dry the bedpan, and store it appropriately. Remove and dispose of your gloves. Exam tip: you must perform hand hygiene immediately after removing gloves to prevent cross-contamination. Offer the resident a damp washcloth or hand wipe. Please clean your hands, Mrs. Johnson. Store any remaining supplies and dispose of trash. Ensure the bed is lowered and the resident is safe. Mrs. Johnson, are you comfortable? Is there anything else you need before I leave? Ensure the call light is within reach and resident rights are respected. I'll be back to check on you shortly. Remember the Prometric checkpoints. Introduce yourself, maintain privacy, and place the protective pad correctly. Raise the head of the bed. Leave the call light in reach and always wear gloves when handling the bedpan. Empty, rinse, and dry the bedpan properly. Offer hand hygiene and always verify resident comfort before leaving. Following each of these steps exactly will help you provide safe resident care while meeting all testing standards. Good luck.